Do you think such successful and celebrated persons like Bill Gates, then George Soros, Barack Obama, Hillary Clinton, the Pope, even Greta Thunberg can somehow be held responsible for manufacturing and spreading the coronavirus? This is a very serious issue, and this type of allegations was doing the rounds on the internet for some time. But you have to decide your position on the basis of evidence you have. We will get back to this issue at the end of the session. Good evening, everybody. This is TITBITS number 8 of the Language Mantra channel. And today we have to discuss some frequently used COVID-19 related terms. COVID-19, it has been devastating all over the world, and it has already claimed some 40 lakhs lives, and it has affected some more than 18 crore people. So it is a pandemic, and we want to discuss some of the terms. This COVID-19 has more than half a dozen names, and with a slight shift of focus, otherwise all these names refer to this COVID-19 virus. So let's see one after another what these terms are. Number 1, COVID-19. COVID-19 stands for coronavirus disease plus 19. Now COVID means co means corona, V means virus, and D means disease. So corona virus disease, that is COVID, plus 19, the year of detection of this virus. Etymologically speaking, the name corona is derived from both Latin and Greek corona. The British virologist David Tyrrell, 1925 to 2005, was the first person to investigate on human coronavirus. But this term appears in print only in 1968. So this is all about COVID-19 in a nutshell. Now come to the term number 2, that is novel coronavirus. There is no difficulty in understanding this one. Actually, novel coronavirus means it is a new coronavirus. That means a virus of the old family with certain new strains or new features. So coronavirus was already there, and this coronavirus has certain new features. So that's why it is called novel coronavirus. And novel means new, nothing else. Then Wuhan coronavirus. Wuhan coronavirus, this name comes from the place of origin, as it is supposed that Wuhan, actually it is the birthplace of coronavirus. Wuhan is a province in China. It is believed that it comes from that Wuhan province. It has another name, that is Wuhan pneumonia. Pneumonia means it's a disease. Actually, coronavirus finally leads to pneumonia. So Wuhan pneumonia means Wuhan coronavirus. That means actually COVID-19 or novel coronavirus. There is not much difference. And now, 2009 nCoV-2. This is an official name used by the WHO means WHO, World Health Organization. Actually, this is an international organization, and they follow the protocol, certain protocol agreed upon by all the member states. The name of the virus given by the WHO is accordance with 2015 medical protocol. They follow certain rules and regulations while naming a particular disease. Next one, long COVID. Long COVID is easy to understand because it refers to the period of suffering of a patient. It takes a long time to recover, and in fact, COVID-19 is a very dangerous contagious disease, and it gives birth to, or it incites other diseases also. That means because of its aftermath, or say side effects, you may have other diseases one after another. So your suffering is always prolonged. That's why this is called long COVID. Then it is SARS-CoV-2. SARS-CoV-2 is another official name. It means severe acute respiratory syndrome. Respiratory syndromes means problem of your inhaling and exhaling. You inhale oxygen, and if you develop corona, in fact, you have problem in inhaling oxygen. This COVID-19, what happens? Initially, during the incubation period, you don't know anything. Slight symptoms are there. You, in fact, develop pneumonia, and this is very serious. And your oxygen level drops severely, and you have respiratory problems. That's why this name is severe acute respiratory syndrome. Then asymptomatic, another term we frequently come across. Asymptomatic means there is no symptom. Initial stage of the coronavirus is like that. You don't have much symptoms. So this is why it is called asymptomatic. Symptoms are hidden in the beginning, but later symptoms are very, uh, acute. Now come to PPE. PPE is actually kind of measures to protect yourself. Now PPE means personal protective equipment. This is specially used by the frontline medical workers, doctors, nurses, and other medical workers working in hospitals. And they have to deal with the patients directly. That's why they need special protections. This is not meant for ordinary people. And here, N95 respirators and kits are considered the most ideal form of protective gears. Now, quarantine, social distancing. These two terms are taken together because in both the terms, one thing is common. You try to isolate people and try to cut the chain of coronavirus. But quarantine is meant for the patients who are already detected positive, and social distancing is a measure meant for those who are not yet infected by the coronavirus. Now come to the next one, that is super spreader, a person with high potential for spreading the disease to a large number of people. Because of your profession or for any other reason, you have to meet many people. In that case, if you somehow get infected by a disease, it is very dangerous. You are a very potential carrier of the disease. Then we have index patient or patient zero. It means the same thing. Index patient or patient zero means the first patient, a person means the first person found infected, be it endemic, be it epidemic, or be it a pandemic, whatever it is. The first patient that is officially detected is an index patient or patient zero. Then we have thermal gun, infrared thermometer, or test skin thermometer. This is what you can see if you go to a supermarket. The guard of the market will test your temperature, but not with an ordinary thermometer. This is a laser gun sort of thing. Just from a particular distance, your temperature will be detected by this machine. This is also a kind of measure so that they can at least try to detect whether you are a potential carrier or not. That's all. Now, lockdown. Lockdown is a condition and certain regulations and restrictions imposed by the administration. It is not as strict as say curfew, but you have certain restrictions. You cannot always go outside, and when you go outside, you have to take your mask. You have to other protective measures you have to take. So this is something what we call lockdown. Maybe entire city is under lockdown, or maybe part of it is under lockdown. The measures are taken to check the spread of this virus or cut off the chain of the coronavirus. So this is all about, and these are the main terms that we have to discuss today. Now at the end, we come back to the issue we raised in the beginning, whether Bill Gates, say George Soros, or Barack Obama, or say Hillary Clinton, the Pope, or even Greta Thunberg could be held responsible. We don't have evidence, but if you have, you decide your position. But there is a rumor that was doing rounds on the internet. Rumor is these two persons, Bill Gates and George Soros, they have a part ownership of a bio lab in the province of Wuhan, and it is believed that they actually encouraged the manufacture of this disease there. That's why their name is involved in that case, and that these two persons did this in accordance with a plan forwarded by Barack Obama, Hillary Clinton, the Pope, and Greta Thunberg. This is all about the story. You believe it or you dismiss it, it's up to you. But take care of one thing: keep yourself safe, use mask, get vaccinated, then wash your hand as many times as you can, then keep social distancing, try everything so that you can keep yourself safe from the Covid-19. And another thing, people are suffering. So if you can, please help them as much as you can. That's all. Thank you very much.